I heard that you were causing quite the commotion, so the staff felt the need to sedate you. I personally do not condone such methods, but since they've already done that for what they felt was their safety, I'm going to give you a few moments to come to. I know some of the side effects of sedation can be grogginess and confusion. So while we wait, why don't we take a moment to go over your chart and I'll introduce myself. I am Dr. Quinzel. Commissioner Gordon, who I'm sure you are aware of, felt that they needed a strong second opinion on your case. So he called me and brought me here to Arkham Asylum to get to know you and see if I can help you. Okay? So, why don't we see what's in this folder here? I know it is rather late at night. However, they called me and let me know that you had some issues tonight and that they had gone with the sedation to calm you down. And I told them that I would come in personally and run your physical assessment tonight. That way, when we have our first real session tomorrow, we can get straight into talking and perhaps, hopefully, then you'll feel more comfortable and willing to open up to me tomorrow. Okay, so let's see what's in your chart here. Okay. It looks like how troubling. They don't seem to have a lot of information here about you on your intake form. It seems that your name is listed as John Doe. And your date of admission is August 1st. It appears they don't have your date of birth, your residency, occupation, marital status. And it looks like they weren't able to get your vitals. It says here that you were uncooperative. I see. Okay. Well, it also looks like your file is rather thick. Okay. Not a problem. Why don't we go ahead and see if I can get your vitals for your form while the sedation is wearing off. And then we can kind of go over what we'll be doing for the rest of your assessment tonight. Okay? Okay. With everything going on right now, I'm going to start by sanitizing my hands. Just to be extra safe, I'm going to put on some gloves. So, you don't have a latex allergy or anything that I should know about, do you? Okay, good. Looks like we're going to start by getting your pulse. For your pulse, I am aware that you are in a straitjacket and are restrained. I personally do not agree with straitjackets as well. I feel like it causes distrust with the patient, and I would like for you to feel comfortable with me. However, since this is the first time that we are meeting, I will leave it on for now, and I will take your pulse from your neck, if that's okay with you. Okay, I do have to get a little close to you to get your pulse, okay? I hope that's okay. Alright. So I'm just going to put my fingers here on your neck. Okay. And we're just going to give it about a minute, okay? About 30 more seconds. Oh, that's very kind of you. Okay. 15 more seconds here. And okay. Done. Alright, that was very good. I didn't feel any issues. Your heart rate seemed a little high, but with everything that you just went through, that's to be expected. Let me just put that here in your chart. Okay. Next, I would like to grab your blood pressure real fast. Okay. I have my blood pressure cuff right here. Now, typically when we take your blood pressure, I would ideally like to do it with no sleeve under the cuff. However, like I mentioned, I would like to leave your jacket on you for now. So I will tuck the cuff around the sleeve. Okay. Just hold still for me. Okay. And let me know if it is too tight. Oh. Okay, well, if you like pain, then I guess we won't have a problem. Okay, very good. I'm just going to remove the cuff. Okay. So, your blood pressure was good. Again, it was a tiny bit high, but with the effects of the sedation and everything that you had to experience before I got here, it's to be expected. Next, I would like to listen to your lungs. So, I have my stethoscope right here. And again, I would normally like to listen with direct contact to your chest. But with the situation at hand, I will do this over the jacket. Okay? Please just take some deep breaths for me. There we go. Keep going for me. It's very good. Okay. Oh, what am I writing? Just that so far you seem to be in good physical condition. Mm-hmm. Yes. Okay. Lastly, I would like to get your temperature. Okay. How are you feeling so far as the sedation is wearing off? that you are uncomfortable or you have any questions, please do not hesitate to stop me and let me know or ask. Okay? Okay. Go ahead and open your mouth for me, and I'm going to place this thermometer under your tongue, and I'll have you close, and we will wait for it to beep. Okay? I'm going to get a little close to you again. Okay? Okay. Here we go. Very good. And close. Okay. Okay. All right. Very good. It seems like the sedation is wearing off just fine. Okay. So we're just going to go ahead and move on to the physical exam. So what we're going to be doing tonight is a quick physical examination, also known as a cranial nerve exam. We just want to make sure that everything is going well for you physically. So I will be testing your senses like sight, hearing, taste, smell, etc. Okay, and tomorrow's session, our real session, is going to be our first sit down and just getting to know each other. Okay, I would like to hear about your past and your present and get to know what makes you you. Okay, so I would like you to feel comfortable with me and feel like you can talk to me. Okay, I would really like to help you. I see. Well, I feel like I can help you. Okay, and I don't really feel comfortable with straitjackets and the cameras around the room. I feel like that adds to distrust with the patient and it disrupts patient confidentiality. So if everything goes well today, I will see to it that tonight they remove your straitjacket after I leave so that you have a good night's rest. And if you promise to cooperate and not attack the staff tonight, I will turn the cameras off and have them leave the straitjacket off and see if we can loosen your solitary confinement to your room so you can walk about and have a more normal stay here at Arkham Asylum. Okay? Good. I appreciate it. So, why don't we go ahead and get started? We can start out nice and slow with your sense of sight. Okay? Now, in front of me, I have a light, also known as a pen light. I know that your eyes might be a little sensitive right now due to the sedation. So if the light at any point makes you feel uncomfortable or hurts your eyes, please be sure to tell me and we will stop. Okay? Okay. First, I'm going to start by shining the light in each of your eyes one at a time and see how your pupil dilates, just to make sure everything is responding the way it should and that the sedation is wearing off. Okay, alright, here we go. It is going to be a little bright. Alright, that looks good. And the next eye here. Thank you. You have nice eyes as well. Okay. Good. And good. Okay. Your pupils are dilating nicely. I am pleased to see that the sedation appears to almost all be worn off by now. So next, I am going to take my light and shine it from eye to eye and keep my hand in the center here and see how they respond. Okay. Okay. Good. Good. Okay. That seems to be good. Everything is responding perfectly. Great. Now, lastly, I am going to need you to simply follow the light with your eyes. I would normally tell you to not move your body, but due to your situation, I know that you cannot. So just please try and keep your neck and your head still. Okay? Great. Here we go. Just follow the light with your eyes. Good. Good. You're doing a great job. Great. Keep going. Good. Okay. Great job with the light test. So, for our next part of your eye exam, I am going to hold my hands up to the side here, and I'm going to have you stare directly at my nose here. And out of your peripherals, I just want you to tell me which hand I have a finger holding up, okay? Okay. And again, please keep your neck and your head as straight and looking forward as you can. Okay. Here we are. Good. 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 Great. Good. Okay. Yes. I like jokes too. Alright. for this next part of your eye exam, I'm going to do the same thing, but this time I am going to hold up some numbers, and I just want you to tell me on what hand and how many fingers I am holding up, okay? Okay. Yes, please keep your neck and your head still. Okay, here we go. 2, 4, 3, 5, 4, 2, 5, 4, and 1. Excellent job. Okay, I'm just going to write that down in your chart here. Just writing down my diagnoses and what I'm seeing so far. I would like you to trust me and feel comfortable with me. So if you would like to know what I am writing down in your chart, or what I am seeing or thinking could help you, I will gladly tell you. Right now, I am just writing down that you passed the first part of the eye exam with flying colors. Okay? Okay. Very good. Now we're going to go ahead and move on to some eye charts, okay? Okay. I'm sure you've seen one like this before. I am simply going to point to a letter, and I would just like you to repeat back to me what letter I am pointing at. Okay? Okay. Here we go. E, good. F, P, T. Oh, very good. C, P, E, C, E. Okay, I know this one's kind of hard, but if you can see it. F, good. And F, great job. Okay, very good. That was excellent. Okay. So far, I do not see any issues with being nearsighted or farsighted. Your sight seems to be very good. Do you by chance have a prescription for any glasses or contacts? No? Okay. Here is the next test. This is a color blind test. I just want to see if you can tell me the number that you see. Okay, very simple. Here we are. So, if you could please look in this first circle right here and tell me what number you see. 7, good. And how about this next one? 13. Over here. your sight seems to be perfect. However, for this last portion of your eye exam, this is going to wrap into a little bit of a mental assessment, but I would just like to hold up some ink blot drawings here, and I would like you to tell me what you see. Okay. Have you ever done a ink blot exam before? I see. People have tried in the past. Okay, well, if you don't mind cooperating with me, I will tell you what I see, okay? I mean, the exam is more for you, but if it makes you trust me more, I will tell you exactly what I see as well, okay? Okay. Here is the first one. Tell me what you see here. Oh, okay. And, all right. What do I see? I see two bears standing back to back. Yes. Let's go ahead and move on to the next one. Alright, tell me what you see in this one. Oh, okay. I could see that. Alright. Let's see. I suppose I see two lions standing back to back. I guess I must have a thing for animals. Alright, let's move on to the next one. This is our last one. What do you see here? Okay. Alright. I see an insect. All creatures today. Alright. Very good job. I just want to write down my findings of your ink blot assessment. Well, I'm writing down that you're right, there is no wrong answer. However, your answers were a bit troubling, not in the way that you would think. Your answers kind of lead me to believe that you have a dark history, a very troubling past that doesn't appear to be your fault, I'm sure. I bet that you have gone through some very heavy things, and it's quite unfortunate. However, you do not have to tell me right now. But I hope that in the future you'll feel comfortable enough with me to let me in a bit so that I may help you. I would like to help you. Okay? Alright. I appreciate your cooperation thus far. Alright. Next, we're going to go ahead and move on to your sense of smell. So I will be right back. I'm just going to grab a couple bottles, okay? Okay, one moment. Okay, I'm back. And I have some files here that, let me explain what we're going to be doing. So, in these bottles, I have some fragrances, and I'm just going to give them a little shake and pop the cork off, and I'll have you close your eyes if you don't mind, and I will hold it up to your nose, and I would like you to take a deep breath in and tell me what it is that you smell. Okay? Okay, so here we go. And if you don't mind closing your eyes for me, I'm going to have to get a little close. Okay. And go ahead and take a deep breath in. Very good. And tell me what it is that you smell. Very good. This one is bitter. Do you know the exact scent? Coffee. Great job. Let me grab the next one here. Okay. There is 4 in total. So here is the next one. Okay. You don't mind closing your eyes again for me? Yes, no peeking. Okay. And go ahead and breathe in for me. Yes, it is citrus. Do you know exactly what fruit? Orange. Great job. I do love oranges. Would you like one for breakfast tomorrow? I would be more than happy to bring you one to our morning session. Yeah? Okay. Consider it done. Let me grab the third one here. Okay. Yes, very good, thank you. And go ahead and breathe in. far too busy with work. Oh, thank you. It would be nice to receive chocolates, I guess. And here is our last one. Let me just get it open here. Okay. Go ahead and close your eyes for me. And breathe in. Yes, this one is very earthy. It's kind of tricky, but can you tell what it is? Pine. Excellent job. You know, a lot of people don't get that one correct. I am very impressed. Okay. I'm just going to put that all down here on your chart. I'm just writing in your physical condition section that so far everything seems in excellent shape. For this next portion, I would like to take a look at your sense of taste. So I am going to start by getting a quick look into your mouth, if that's okay. So I have my pen light again. And I would like you to open your mouth and stick your tongue out and go for me. Okay, I'm going to get a little close again. Okay. If you don't mind sticking your tongue out a little further. Okay. That looks very good. All right. So, I have 4 bottles again for your taste portion of the exam. I'm going to give them a little shake, and I will have you stick out your tongue, and I will put a couple drops and have you tell me what it is that you taste. Okay? And if you don't mind, keeping your eyes shut for me again so that you can't read what is on the bottle. Thank you. Okay. If you could close your eyes for me and stick out your tongue. Just going to put a couple drops and go ahead and tell me what it is that you're tasting. Good. Do you know the exact taste? Yes, it is peppermint. Good job. I too love mint. Okay, here is the second file. Okay. To give it a shake. Please close your eyes for me and stick out your tongue. Thank you. Okay. Yes, this one is fruity. Do you know the exact fruit? Strawberry. Great job. Okay, the third one. And again, just a couple drops here on your tongue. Very good. And can you tell me what that one is? Yes, that one is very sweet. Vanilla, correct? I suppose that one is pretty easy. Oh, thank you. I'm glad that you find me sweet. And here is the last one. I'm just going to shake it up. And close your eyes for me one last time. And your tongue. And go ahead and let that coat your tongue and tell me what it is that you taste. Lemon. Great job. So again, I don't see any issues with your sense of taste. So let me put that here in your chart. That everything is testing excellently. Okay. We're getting close to the end here, and then I can let you go ahead and get back to your room and get some sleep, okay? Okay. We're going to go ahead and move on to your sense of touch. Normally for this part of the exam, I would do a bit more, but again, considering your current situation, I am going to stick with your facial features, and your facial muscles. Excuse me. And we will go ahead and maybe take a brief look at your shoulder movements. Okay? Okay. I have in front of me a pointy end. It's kind of sharp. And a soft end. Okay? And once again, I'll have you close your eyes and I will get a little close to you and touch either end to your face. And I just want you to tell me on what part of your face you feel the pressure and if it's soft or sharp. Now you may be thinking that you're scared that it is going to hurt. I can assure you it is not that sharp and I will not apply that much pressure. I see. Even if you like pain, like yourself, it will not hurt that bad. Okay, so go ahead and close your eyes for me. And here we go. Sharpen your forehead. Soft and cheek. Soft and cheek again. Soft nose. Sharp chin. Sharp forehead. Sharp cheek. Soft nose. Sharp cheek. Soft cheek. Sharp chin. Soft forehead. Excellent job. See, that wasn't so bad, was it? I do try to have a gentle touch. Next, I'm going to check your chin reflexes. So I'm going to take 2 fingers and place it right here on your chin and give it a little whack. Okay? I hope that's okay with you. Alright. And here we go. Okay, good. And one more time. Good. Very good. Alright, could you just smile real big for me? Beautiful smile. Okay. And frown. Good. And go ahead and just puff out your cheeks for me. Good. Lastly, I would like to test your shoulders. So I'm going to simply place my hands on your shoulders and I'm going to apply some pressure and push down. And I just want you to use your muscles to keep your shoulders up and don't allow me to push them down. Easy enough. Here we go. Before that, I'm just going to tighten your restraints real quick. Again, I don't believe in restraints, but as long as you cooperate with me and I feel that we have trust, I will have these removed tomorrow. Okay. Here we go. And go ahead and push up. Okay. Very good. You seem to have very strong muscles. Just going to put that in your chart. Okay. So, you seem to be in peak physical condition. So far, so good. I don't see anything wrong in your physical assessment. We just have the hearing portion left, okay? So for the hearing test, I have a tuning fork right here, and I'm going to have you close your eyes. I know I have you do this a lot, but we're almost done. I do appreciate how you've been so willing to cooperate with me. I'm going to have you close your eyes. I'm going to give it a whack, and I'm going to hold it up to your ears. And I just want you to tell me what ear you're hearing it and when it stops. Okay? Perfect. Go ahead and close your eyes for me. Here we go. Good. Okay. Good. Good. And one last one. Great job. Okay. You did excellent with the tuning forks. We have one last hearing test. I am going to have you close your eyes, and I am going to walk behind you and whisper some words into your ears, and I just want you to repeat them back to me. Okay? Great. Go ahead and close your eyes and we'll get started. Okay. I just want you to repeat this word back to me. The first word is Arkham. Arkham. Good. The next word is examination. Examination. Good. Okay. The next word I would like for you to repeat back to me is pencil. Pencil. Good. The next word is clown. Clown. Good. last word I would like you to say back to me is doctor. Doctor. Okay, that was very good. You seem to pass your physical assessment or cranial nerve examination with flying colors. Yes, you seem to be in great physical condition. So, for tomorrow's session, I will be just asking you questions and we'll be going over your mental state of admission. And I basically just want to get to know you. We don't have to get too deep. I don't want to make you uncomfortable. I want you to trust me. So I'll just kind of ask you about your past and whatever you're willing to tell me on this first session together. I'd be happy to hear it. It says here on your Arkham Asylum intake form that you've been pretty much a lockbox and not willing to let people in. I would really like to assist you, and I can only do that if you're willing to open up to me. So I would really like to learn everything there is that makes you you, or that got you to this point, past, present, and future. Okay? I would like you to consider me a friend. You have been very cooperative, so you can go ahead and call me Harleen tomorrow. Okay? Yes, my first name is Harleen Quinzel. I see, I get that a lot. It reminds people of the clown Harley Quinn. I suppose if it makes you feel more comfortable with me as your doctor, you can call me Harley. That is fine, but in that case, I would like you to give me a proper name that you feel comfortable with me calling you, because on your intake form, it says that your name is John Doe. So if there's a better name I can call you, in turn, you can call me Harley. Joker. Okay, I will call you Joker. Alright. Well, Joker, it was a pleasure getting to know you tonight, and thank you. I will see you tomorrow, and for being so cooperative, I will have the staff remove your straitjacket and let you sleep without it on, and you can come to tomorrow's session without it. Okay? Alright, I will see you tomorrow. Sleep well.